Yo, what up, y'all? It's your boy Rob coming back at you once again with another video. So before we get started, you already know what to do. If you're not subscribed to the channel, make sure you hit the bell icon twice. Smash the like button, share this video out to all of your followers, and let's get it cracking. All right. So shouts out to everybody that comes into the room. You guys already know what it is. Make sure that you guys smash that like button. Also, make sure that you hit the bell icon twice. And if you're not subscribed to all the channels, take a moment, make sure you hit the about page and the channel page and subscribe to all the other channels, as well as my social media. We got Carlton Way in the building early, and we got my man U-Law in the building. What's good with y'all? I hope that all is well. Now, I got a question for everybody. Depending on how quick I get done with this, I was thinking about doing a Tales from the Cryptocurrency stream because there's some interesting things popping off with cryptocurrency. Just so y'all know, within this month, apparently it's been projected that Ethereum could possibly go below $1,000, which, depending on what your investment strategy is, could be a really good thing. And also, from what I hear, there could possibly be an Ethereum hard fork called ETHPOW. So I was thinking about possibly going live on that. If, we get done in a timely fashion, I might actually do that. If not, I'm going to try to fit it in tomorrow. All right. So shouts out to, hey, Mr. Knickerbocker. We got my man Volvo 2 Love in the building. We got Cameron Jones up in here, and we got Carla Lockhart. What is up with y'all? Good to see y'all. So I don't know if you guys are aware, but there's some research and some evidence that shows that C19 is leaving people sicker. All right. Remember, that's one of the things that we talked about when this whole thing first started. What I was saying about COVID-19 was that I wasn't really interested in what was going on immediately, but because COVID-19 is a virus, what I was most interested in are the effects that take place long term. You know what I'm saying? And because COVID-19 had just happened, we don't know what the long-term effects of it are. It hasn't been a 5, 10, 15-year period where we would know what it's causing. You know what I'm saying? Viruses like HPV, human papilloma virus, cause things like cervical cancer, and there hasn't been enough of a time period to say what is going on versus what isn't. All right, but this is an article from the Financial Times, and this article from the Financial Times is saying that there's growing evidence that COVID-19 is leaving people sicker. Now, I do know some people who claim to experience some long COVID symptoms. You know what I'm saying? But even long COVID is not really, quote, long COVID, because COVID-19 has only been around since 2019. The earliest documented evidence of it, I believe, have been since 2018. So even still, that's not even a 5-year period. You know what I'm saying? So it's too early to say what is versus what isn't, but apparently there's some evidence here that they have that they want to present where they say, yeah, you know what, this thing could be making people have some after effects. So let's check this out and see exactly what it is that they're talking about. This article here is from August 30th of 2022. All right, hold on real quick. Let me see. I don't know what. Okay, there we go. Hold on, give me 1 second here because it looks like I might need to refresh the screen. Yeah, I do. Okay, here we go. So now here it says, when Dr. David Strain encountered a 64-year-old patient on his ward round, the British geriatrician had a bleak epiphany. Less than 6 months earlier, he had treated the man for COVID-19. Now his deterioration was painful to witness. He came in with a stroke and a really bad delirium, a precursor for dementia, Strain says. I saw the patient, recognized him, and recognized the fact that his brain had dramatically aged. Now, I don't think that any of you all have been around for the entire life of the channel, except for U-Law. U-Law is in the building, and U-Law has been around since the very first video that was dropped on this channel. And we actually were talking about the neurological effects of COVID, and we were asking the question, why is it that people are not talking about the neurological effects of COVID? Because early on, there was a lot of evidence that COVID-19 affects your neurology. There's a lot of effects that it had. That there's a lot of evidence that it affects your cerebral spinal fluid. There's a lot of evidence that it affects your brainstem. There's a lot of evidence that it affects your cognition as well as your senses, mainly your taste and your smell. And your taste and your smell are senses that are directly indicated when it comes to some of the initial signs and symptoms of dementia or early onset Alzheimer's. We were asking those questions last year. You know what I'm saying? Last year, we were asking those questions because the evidence of that was coming out last year. That's not what the mainstream media or people that follow this kind of thing chose to focus on, which I found fascinating because without a brain, how are you going to function? This clearly affects your cognition. One of the issues with long COVID is that people who experience long COVID have issues with thinking. They have issues with cognition. They have issues with thought process, as well as other things like taste and smell. But it's not something that the media chose to concentrate on. So, you got to ask yourself that question. You know what I'm saying? So now here it says, less than 6 months earlier, he had treated the man for COVID-19. Now his deterioration was painful to witness again. He came in with a stroke and really bad delirium, a precursor of dementia, Strain says. I saw the patient, recognized him, and recognized the fact that his brain had dramatically aged. Now, here's another thing, and this is something that people aren't really asking about. Do you all think that the treatment for COVID could possibly have something to do with this? If you guys think that the treatment for COVID could possibly have something to do with this, give me a thumbs up. If you guys don't, give me a thumbs down. You know what I'm saying? So now here it says, by unsettling coincidence, the same day Strain, who is based at the University of Exeter in England's West Country, had read a newly published study which identified significant brain shrinkage in a cohort of about 400 people aged between 51 and 81 who had recovered from COVID-19. Now, here's my question. Why would brain shrinkage occur? That's a question. It says he read a newly published study which identified significant brain shrinkage in a cohort of about 400 people. And these people were older. They were aged between 51 and 81 who had recovered from coronavirus. So now that's my question for everybody. Why would the brain shrink? Shout out to my man Cameron Jones and shout out to Pirate. What's up with y'all? Because that is definitely a symptom that could occur. But the question is, why would it occur? That's the question. Why would that occur? Why would that happen? You know what I'm saying? So now here it says the encounter crystallized Strain's belief that COVID generated a kind of epidemiological aftershock, leaving people susceptible to a huge range of other conditionings, threatening global health systems already struggling with insufficient resources and aging populations. It made me realize that this is something we're going to be facing in a really big way in the near future, he says. And I agree with that. Now, my thing is, I don't know exactly what it is, but I saw immediate effects of C19 in people that I dealt with. There was interesting things that took place. A lot of people who had it, they had symptoms of asthma kind of dissipate. They had symptoms of diabetes kind of dissipate. A lot of the people who had the early strains of it, things that I saw in dealing with them in a clinical setting, they came back not on blood sugars. They came back not on insulins. If they had COPD, they came back not on inhalers. So it was very interesting. You know what I'm saying? My man Cameron says he developed high blood pressure a month after getting the jab. Shout out to Roots Tracker. Ulaw says, I'm mad at the CDC for not taking this virus seriously, especially in a country with no universal health care. Yeah, that's one of the things that we were saying in the beginning. We were critiquing like what's going on with how they're dealing with this. You know what I'm saying? They're still not dealing with it properly. You know what I'm saying? So now here it says, as he started to see a rise in certain conditions in the first year of the pandemic, Strain assumed it was a result of people being unable or unwilling to access healthcare. Only as the pandemic entered its second year did he begin to suspect that COVID itself could be increasing vulnerability to other serious illnesses. He now sees it as an inversion of the huge drop in respiratory illness doctors saw from the 1980s onwards, when millions either stopped or reduced smoking. The level of damage that's been done to the population's health during COVID, it would be as if everybody suddenly decided to take up smoking in one go, Strain says, which again, it's interesting. It's very interesting the things that they're choosing to focus on. You know what I'm saying? So now here it says, while more data will accumulate in the coming years, there is already evidence to back up his concerns. A Financial Times analysis of data from the UK's NHS, one of the world's richest health data sets, shows how significant rises in deaths from heart disease since the start of the pandemic in all but the very oldest age groups. In the group of 40 to 64 age group, heart attack deaths increased 15% in 2021 compared with 2019. Now, here's my question for everybody. Why would that happen? What's the logical reason behind why that could possibly happen? Because there, in my opinion, there could be something to that, but what is it that it would be that would be the cause of it? That's the question. What is it that would be the cause of it? Why would that be occurring? There's a reason. And in order to understand the reason, you have to understand how COVID-19 works. And real quick, ladies and gentlemen, we got 8 people watching. Shout out and thank you to all the 8 people that are watching. If everybody can take a moment and smash that like button, we will be at 15 likes. So please make sure you guys smash that like button. You guys know we got a goal of 100 likes per stream. So please make sure y'all help with that and smash that like button and also share the video out. Eulaw says, my wife is a nurse practitioner and she is seeing more people come in the hospital with COVID as of late, vaccinated and unvaccinated. Now, here's my question for you, Eulaw. Why do you think that is? Because if you guys have been watching this channel, checking out the videos, you will know exactly why that is. Carla said, if it affects the brain fluid, then maybe having less brain and spinal fluid shrinks the brain. Yeah, that's actually a great answer. My thing is, it also has to do with oxygenation. You know what I'm saying? One of the things about the early strain of COVID was that it was really attacking people's respiratory system. It was attacking their lungs directly. And if it's attacking their lungs directly, then that means that there would be a difficulty in oxygen exchange, which would cause hypoxia. You know what I'm saying? And if there's an issue with hypoxia, then that means that the brain is definitely not getting the oxygenation that it needs, which would slow down the metabolism and cause necrosis and ischemia in some areas. You know what I'm saying? So now here it says in February, meanwhile, an analysis of more than 150,000 records from the national healthcare databases at the U.S. Department of Veteran Affairs suggested that even some people who had not been seriously ill with COVID had an increased risk of cardiovascular problems for at least a year afterwards. Now, again, here's my problem. There's a specific reason of why that could be. Shout out to my man, Deformed Pretty Boy. What up with it? There's a specific reason of why that is. Why? Why is that? Let your boy know why. There's a specific reason. Now, let's go and talk about this reason. All right. So let's talk about Eulaw's comment first. Eulaw says, my wife is a nurse practitioner and she's seeing more people come in the hospital with COVID as of late, vaccinated and unvaccinated. Now, why would that be? In my opinion, more than likely, that's because BA4 and 5 are the dominant strains. And as of now, with BA4 and 5, one of the things that's a characteristic of BA4 and 5 is that they cause breakthrough infections and that they're able to kind of skirt the body's defenses and move beyond those vaccines, which is one of the reasons why they're creating the new vaccine specifically for BA4 and BA5. So BA4 and BA5, that would be my assumption of why that's going on. You know what I'm saying? So now, why would people be having cardiovascular problems as a result? That's the question. The reason I think that people could possibly be dealing with cardiovascular issues as a result is because some of the COVID strains directly attack the ACE receptors, the ACE receptors, the ACE2 receptors in the lung tissue. And the ACE2 receptors are directly responsible for blood pressure, which could cause issues with systemic and diastolic blood pressures, which could be related to the contractibility of the heart and could cause heart issues. You know what I'm saying? Also, again, anytime there's decreased oxygen, you're always at a risk of infections because of ischemia. There could be some of that going on too. You know what I'm saying? It could be some endocarditis and different stuff like that. So Cameron says, my parents are vaxxed and they had it twice. The first time was worse. See? And again, we know that that's called breakthrough infections. You know what I mean? And the strain that's causing a lot of breakthrough infections are the strains that are the dominant strains in the United States right now, which are BA4 and BA5. You know what I'm saying? So now here it says researchers found that the rates of many conditions such as heart failure and stroke were substantially higher in people who had recovered from COVID than in similar people who had not been infected. Now, again, they need to do a further study on these people who recovered from COVID and see if they got any treatment, because it could possibly be the treatment and not actually COVID that could be causing this. You know what I'm saying? We all know what some of the side effects of the vaccine were, and some of the side effects of the vaccine had to do with issues like clotting, which issues like clotting are the predecessor to a stroke. So that's the stuff, in my opinion, that needs to be looked at. If you guys agree, give me a thumbs up. If you guys disagree, give me a thumbs down. So now here it says a separate analysis of VA data published in March suggested that in the post-acute phase of the disease, people with COVID exhibited increased risk and burden of diabetes. So you guys remember I had told you that in my clinical experience, I saw people who had diabetes, their diabetes was affected. So this article, despite the fact that it's showing a different kind of effect of the diabetes, it validates the fact that the diabetes are affected. You know what I'm saying? So again, nobody's making this stuff up. So now here it says what's particularly alarming is that these are really lifelong conditions, says Dr. Zaid Al Ali, chief of research and development at the VA St. Louis healthcare system and clinical epidemiologist at Washington University in St. Louis, who led both pieces of research. While just 4% of people while just 4% more people contracted heart failure following a COVID infection than those who had not been infected, because the number of people infected with SARS-CoV-2 in the world is colossal, even small percentages will translate into absolute large numbers. But again, one of my big issues with this entire thing is that we're not looking at everything the way that it needs to be looked at, if you ask me. You know what I'm saying? If you ask me, one of the things that they need to be looking at is also people who got the vax. You need to separate that group of people who, quote, recovered from COVID and see what kind of treatment they had. There could be some people that didn't get treatment. There could be some people that did get treatment. And then there could be some people that were vaxxed. And then there were people that are non-vaxxed. All of those subgroups need to be broken down, in my opinion, and studied individually. If we just study them as a big lump, we're not discriminating, so we don't know exactly which factors did what. But see, when you ask those kind of questions, that's when your platform is in danger of scrutiny. You know what I'm saying? That's when you get in trouble. That's why you guys have seen no growth on this channel. You know what I'm saying? That is why this channel has 2,274 watch hours and only 262 subscribers. That's the reason why that is. You know what I'm saying? That's why that is. So now here's a chart with the heart attacks. Heart attacks on the rise in almost every age group. Change in number of deaths caused by heart attack by age group in 2021 compared to 2019. So as you guys can see, I mean, all of the graphs are above zero. So there's been an increase going from 1 to 34 all the way down to 80 to 84. Just these, and this blue section indicates the increases. You know what I'm saying? So now here it says, will it be sufficient to elevate the burden of chronic disease and subsequently put an additional strain on healthcare systems? We think the answer is yes, he adds. Some researchers caution that it is too early to draw broad conclusions from limited data. Dr. Christopher Murray, director of the Seattle-based Institute for Health Metrics and Evaluation, says the increases might also reflect inconsistencies in reporting. I think that there's inconsistencies in data gathering methods as well. Like I said, they're not separating the control groups properly. They need to be very specific on how they separate the control groups, in my opinion. If you guys agree, give me a thumbs up. If you guys disagree, give me a thumbs down. So now here it says in the first year of the pandemic, for example, many of the deaths in older people had been assigned to dementia when they may in fact have been due to undiagnosed COVID, which had high death rates in the very elderly. Disentangling that is quite tricky, he says. And again, in my opinion, we all criticized how they were marking deaths based on COVID in the beginning. So based on how they were doing that, that could possibly be why it's so hard for them now to discern data. That could be the reason. You know what I'm saying? Everything that happened at that point was based on COVID, they said. Every single thing. Anytime somebody died, it was a COVID death. It was a COVID death. This is a COVID death. This is a COVID death. Okay. Well, now when you're trying to go back and do research and you've lumped all of that stuff together indiscriminately, now you have to reverse engineer it and see what actually was a COVID death versus what wasn't. That's time consuming. You know what I mean? So now here it says in the first year of the pandemic, for example, many of the deaths in older people had been assigned to dementia, when in fact they may have been due to undiagnosed COVID, which had a high death rate in the very elderly. Disentangling that is quite tricky, he says. So now what I find interesting is, how do you assign a death to dementia? How does that work? See, when articles say things that are kind of strange, you need to be able to pick up on that and ask those questions and not just take it, not just take it in. Ask yourself the actual question. Well, wait a minute. How does that work? How does one die of dementia? And now I'm asking you guys that question. How does one die of dementia? Is there anybody that has that answer for me? How does a person die of dementia? And real quick, ladies and gentlemen, we got 11 live viewers. Shout out to all 11 people that are watching, and we got 8 likes. If everybody could take a moment, smash that like button and get us to 19, I'd be very appreciative. So now here it says when they may in fact have been due to undiagnosed COVID, which had a high death rate in the very elderly. Disentangling that is quite tricky, he says. But although the evidence is still coming into focus, it is already becoming clearer to clinicians and health leaders in medical systems around the world that they are coping with a higher burden of disease in the population, whether from increased susceptibility to illness after COVID or from the lingering, little understood impact of long COVID or a backlog of patients. Now, you guys remember when I said that COVID is here to stay? And I said that one way that people can get into business and do things to empower themselves and make more money is by championing and understanding COVID and coming out with COVID remedies. People were too caught up on conspiracy theories to take advantage of the opportunities that presented itself through COVID. People were too busy drinking that Alex Jones, even the frogs are gay water, to see how to empower themselves. Another lost opportunity, because here it is, 2022, getting close to 2023, and we're still dealing with COVID in the front page news. And if anybody doesn't believe that financial empowerment could have came through COVID, all you got to do is just take a look at the stock prices of Pfizer, take a look at the stock prices of Moderna, take a look at the millionaires, billionaires who have increased their net worth during COVID. The money was there. You know what I'm saying? But where was the focus is the question. Look at this. I'm going to show you guys something. I think TD Hip Hop Media did a video about this too. Watch this. It was an article that The Guardian had put out, but we don't need to look at The Guardian's article about it because there's plenty of evidence. And what I find fascinating about all of the evidence here, and as a matter of fact, I think what I should do is I should actually make a All Money Ain't Good Money series for COVID. That's what I think I should do. What do you guys think? Should I do that? Here's an article from Fox. Billionaires got $283 billion richer during COVID. All right. 8 billionaires have gained $1 billion in additional wealth since January 1st. And this is an article that was published on May 2nd of 2020. So imagine how much they gotten since then. All right. Now, here's another article from USA Today. Jeff Bezos, Elon Musk, among U.S. billionaires getting richer during the pandemic. This article was published December 1st of 2020. Okay. Now, here's another one. You guys ready for this one? How billionaires saw their net worth increase by $500 billion during the pandemic. You know who didn't get any money during the pandemic? Take a wild guess. Take a wild guess. Take a wild guess. I need you guys to take a wild guess. as much as we play craps in the hood, you know what I'm saying? You would think that people wouldn't roll snake eyes so much. That's what you would think. Carlton got it. Coronavirus pandemic and the racial wealth gap. The unjust racial wealth gap leaves Black and Latinx communities especially vulnerable to the COVID-19 virus. Some people were making money during it. You know what I'm saying? Yeah, you would think as much as motherfuckers play craps, motherfuckers would stop rolling snake eyes. You know what I mean, Cameron? How the racial wealth gap is widening. You know what I'm saying? Because of the pandemic. This is from September 18th of 2020. Now, here's my question. If the racial wealth gap is widening because people don't have adequate access to healthcare, and it's also widening because, let's not get it twisted, one of the reasons why it's widening is because so many white billionaires are balling out. So you got black people getting poorer at the same time that Elon Musk and Jeff Bezos are getting mega rich. So you have the lack of employment as a result of COVID-19, and you have the increase in white wealth as a result of COVID-19. I mean, mathematically, what does that do? Then you got to ask yourself the nasty question. Is the math correct? Is the world correct? Or are people correct? You know what I mean? Opportunities was there. Opportunities have passed. You know what I mean? Pfizer's stock price is in the clouds now. It wouldn't even make sense to invest in Pfizer unless something else goes crazy, because I mean those prices are maxed out. BioNTech, even Merrick. We'll be talking about ivermectin later. We talked about ivermectin on this channel with Joe Rogan. Not with Joe Rogan. Of course, Joe Rogan would never have a conversation with me on my platform when there's a white person who he could have a conversation with. But we talked about that content. And, you know, it's just not something people are interested in. But what I find fascinating about the interest factor is that people are interested in how little money they have in their bank accounts. Like, that's something that's very interesting to people. Why am I so broke? We should put that question into an artificial intelligence simulation and run that simulation and see the answer that it spits out. What answer do you guys think that it spits out? Carlton knows what answer it'll spit out. You know what I'm saying? So now here it says, at the same time, over the past 2 years, many workers have burnt out or were lost fighting the pandemic on the front lines. Our capacity may be shrinking at a time when the demand in population is increasing, warns Eric Schneider, an executive vice president at the National Committee for Quality Assurance, a nonprofit organization that focuses on improving healthcare quality. The combination of rising disease levels and scarce resources is forcing medical professionals to reevaluate the way that they practice medicine, organize healthcare, and putting greater emphasis on preventative care, collaborative working, telehealth to manage chronic diseases and boost population health. So now here's my question. If you're reading this article, do these sound like opportunities for businesses? Do these sound like opportunities that people can get into in order to improve their wealth? It does to me. But for some reason, though, you don't see people doing those things. My question is, if the wealth is an issue, why are people not doing things to create wealth? That's the question. I let's put this into perspective. I guarantee you that there's more people that can tell you the anti-FBA comments that Buster Rhymes made about hip hop than there are people that could tell you about financial opportunities within the C19 ecosystem. But my question is, are those anti-FBA comments that Busta Rhymes and Fat Joe made, whether they cop to the fact that FBA created hip hop or not, is that going to increase the racial wealth gap? Is that going to provide more independent wealth for people? And here's another question about that whole hip hop wars thing. Last time I checked, it wasn't FBA, non FBA, or Latinos who were running any hip hop businesses. Last time I checked, a specific group of Europeans were the ones paying the paychecks. And also, they were the specific ones who owned most people's masters. So if anybody should be fighting anybody, I don't understand why they're sitting there smoking cigars instead of getting smoked. But again, that's just something that me and my pea brain don't understand. Because again, I do have a pea brain. You know what I'm saying? So yeah, put the seatbelt on and make sure that the roll cage is activated. We going off code. But you got to ask those questions though, so that you don't get stuck in a hamster wheel. Because hamster wheels only help hamsters. You know what I mean? So now here it says, given the many challenges healthcare professionals are facing, it's impossible to square the circle unless we're prepared to very fundamentally rethink how we deliver healthcare. So now here's a thought. Here's a good business idea, right? Because that's all I do on most of my channels is give just innovative business ideas for free. You know what I'm saying? Why don't people come up with an app where people can spot C19 test or spot C19 vaccinate or spot C19 deliver C19 specific therapies? It would be like Uber, except for if you have C19 symptoms, instead of going out in public, you push the app and say, hey, I'm having some issues. Can someone come test me? You get a nurse or a person that's able to test you come right to your building based on the app, or come right to your house based on the app. Basically, like, one of those urgent care, but urgent COVID on wheels. Why not do that? You know what I'm saying? I'm sure that's a business that will flourish because, again, like they say in this article, this is a time where we're rethinking how to deliver healthcare. And when they say how to deliver healthcare, why not actually take that literally and actually deliver healthcare? You know what I mean? Just a thought. So now here it says you have to think of the whole patient. Many of these changes were under consideration before the pandemic struck, especially in countries with aging populations. But the crisis has accelerated their implementation while also serving as a kind of large scale demonstration project for the advantages of a different approach. One lesson the pandemic has taught, say experts, is the degree to which different conditions intersect and how that affects patients' potential to recover. I do think the connection between chronic disease risks like diabetes, obesity, and infectious disease outcomes, which people knew abstractly, has become so tangible during COVID that it is breaking down some of those barriers, says Murray. For infectious diseases specialists like himself, he says the past 2 years had led to a growing awareness that you have to think of the whole patient. You can't think of managing pandemics or infectious threats as distinct from good management of primary care and general health of the community and patients. Now, I agree with this 100%. But what I find fascinating is that they're not doing that with monkeypox. Yeah, I'm not tripping because we make house calls for delivery all the time. There's Instacart, there's Uber, there's DoorDash, there's there's FedEx. Most people have a ring camera or a security camera, and they could equip their nurses or whoever's delivering the healthcare with a body cam equipped with E911 uh with E911 what is that? Satellite relay. So, I mean, yeah, this is America, the country that has the highest incident not only of COVID, of monkeypox also. You know what I mean? I don't think I'm tripping because everything that I ever say on this channel, whether it's a month, 2 months, or 3 months later, it always comes true and happens. And then people will say, "Did you see this Jimmy Dory video where Jimmy Dory said some shit that I said like 6 months ago?" You know what I'm saying? I don't think it's me that's tripping. You know what I mean? So now here it says the effect of that may be the greatest in middle income countries. He argues where a lot of health policies are still focused on maternal and child health and infectious disease. And now the connection to diabetes, heart disease, and chronic conditions is so obvious that you will see more health systems interest and attention on tackling these issues, he says. So there's that. So, hey, Mr. Knickerbocker says people can kind of afford food and things. Healthcare is a different animal. There aren't enough healthcare professionals to provide house calls. Nobody's even tried it. And when COVID-19 hit, there were plenty of healthcare professionals working hell of overtime hours to get surge pay and COVID pay, going through agencies working COVID units. Healthcare facilities were burning through their COVID bonus money that was given to them by the government like wildfire. You know what I'm saying? If there's jobs available, people will work them. You know what I mean? And as far as healthcare being a different animal and people not being able to afford it, initially when COVID first happened, vaccines and testing was all free from the government. Anything that resulted from Operation Warp Speed was free. It was taxpayer funded. And testing still should be if you actually know how to get the testing for free. You know what I'm saying? You can look that up. That's on the department or the CDC. It's also on the National Institute of Health website. And if you go directly to the parts about Operation Warp Speed, it'll say that. You know what I mean? And then if you're just getting a vaccine or if you're getting a COVID test, that's just an assessment. And the thing is also there's home health care and hospice already as well. You know what I'm saying? So, I mean, those kind of businesses are already set up for that. They can implement that right in. The thing is that when it comes to these kind of innovative things, again, what happens is somebody else is going to do it. You know what I'm saying? Like I can say this right here, and then there's a limited window to when somebody else is going to do it. Just like how I said they need to start talking about monkeypox in terms of LGBTQ men. There was about 3 or 4 months when they just wouldn't do it. They just wouldn't do it. They just wouldn't do it. Now they're doing it, and now the monkeypox numbers are going down. You know what I mean? So again, I don't know. You know what I mean? So you gotta ask yourself these questions. So like, and then here, you know what I'm saying? Like this was all mandated by the government. This was all mandated by the government. You know what I mean? And like the thing is, like you can get it or you can wait. Or as far as COVID testing goes, your job should be COVID testing you. So if your job is your job charging you for COVID testing? You know what I mean? Like, how does that work? This is shit that came directly from the FDA. This is all shit that anybody could look up if they want to. It's basic shit. COVID-19 vaccine or booster. Schedule your families free. This is Walmart, or I mean Walgreens. You know what I mean? I don't know. I don't know. Another place where they give you vaccines, at least. And then if you're your own employer, I don't know how it works in Georgia. I don't know if you applied with the federal government or if you worked with the the Georgia government. I don't know. That's however you conduct your business. If you're your own employer, you should be able to just request that stuff from the government since you're an employer. So I don't know. You know what I'm saying? So now hold on real quick, y'all. So now here it says, even in the rich world, however, COVID has created a new understanding of the different elements that contribute to keeping people healthy. This spans not simply medicine in its conventional sense, but nutrition and decent housing, for example. And this is what DJ Elmo is always talking about as far as the nutrition aspect of COVID-19. That's one thing that people don't talk about, like vitamin D, right? Like that's something that we talked about on vitamin D. But like one thing that we cannot deny is the lack of interest in basic things like keeping yourself safe from COVID-19 is a huge reason of why people are having such a hard time with this. There's just a lack of interest. Immediately when something like this comes out, it's a conspiracy theory. You know what I'm saying? Everybody just gets on the Alex Jones train. I mean, like the the behavior of the public is just it's just absurd. You know what I mean? Like it's just crazy. It's people do shit to their own detriment and then wonder why they're dealing with a detriment. You know what I mean? And like the thing is that there's no public accountability. That's why I used to have an issue. Shout out to my man Mike Mellis John. What up with it, bro? I used to have an issue with depopulation. I'm all about it now. Thanos did nothing wrong. You know what I'm saying? Hashtag Thanos. Hashtag Thanos did nothing wrong. Hashtag the elites are right. You know what I'm saying? Like the elites are correct. Yeah, facts. I still see people not washing their hands after using the bathroom. Facts. They still do it, bro. And probably because they went back to school around other kids. You know what I'm saying? Like one of the things that people shouldn't have been doing is in situations where they didn't need to, being in crowded environments. That's one of the reasons why they recommended social distancing. You know what I mean? But again, everybody was on this. it's just a conspiracy theory shit. You know what I mean? Like I don't know how that works. Like it's either real or it's not. You know what I'm saying? Like I actually work in healthcare and I'm dealing with people that actually have it. And I'm like, yo, this shit is real. People are dealing with it. And it's like, nah, you know what I'm saying? Like, you just a coon and shit. It's like, what? You know what I'm saying? Like, nah, bruh, that don't have anything to do with it. This ain't the coon virus. Like, this is some real shit. Big homie Bill Gates coming in like Thanos. I'm not mad at him anymore. I get it now. I get it. What are people actually doing besides taking up space and shitting, producing trash, producing carbon dioxide, and taking up space? How, out of all of the people on the planet, how many people are actually doing anything meaningful to further the advancement of the global human race? How many of them are actually doing anything like that? None. You know what I'm saying? So it's like if you're not doing that, and we live on a planet and we're constantly under the threat of existential threats, if you're not contributing to getting rid of those existential threats, you're taking up space and resources that somebody else could be utilizing, or that a machine or artificial intelligence could be utilizing to do that. I hate to say that, but people have created that case for themselves. People have become useless. You know what I mean? So like check this out though. Hey, Mr. Knickerbocker, like we'll say people who do stuff benefit to try to benefit everyone get dealt with, right? Okay, but like there's only like a few people getting dealt with once in a blue moon. It's not like there's just droves of people getting slaughtered. You know what I'm saying? Like you got Dr. Sebi. You know what I'm saying? You got that Canadian, that Asian lady who was trying to tell everybody about C19. You know what I mean? I mean, it's not like they're executing thousands of people a day who are trying to make the world better, because there's not even thousands of people that have the IQ to even try to figure out the first steps in trying to make the world better. You know what I mean? Deformed Pretty Boy says, dude, you didn't wash your hands. And literally with all these diseases, you touched your little pecker, and you're gonna touch the mail and pass to people. You nasty ass. You don't want to know his race. So yo, everybody in the comments, let's guess the race of the males man, of the mailman. You know what I'm saying? My man Jada Informant said, just today I was planning on taking over the world with my boys Pinky and the Brain. That's what we should be on. World domination is the only solution. And if people don't want to dominate the world, if you don't live in domination, you live in subjugation. So that's what we're experiencing now. That's the phenomenon that people call white supremacy and racism. You guys agree with Cameron? If you guys agree with Cameron, give me a thumbs up. If you guys disagree with Cameron, give me a thumbs down. And real quick, ladies and gentlemen, if you guys have not smashed that like button, please make sure that you guys smash that like button. Also, if you have not shared the video out, please make sure that you guys share the video out. And if you're not subscribed, also make sure that you hit the bell icon. We got 15 live viewers and 8 likes. If everybody hits that like button, that'll take us to about 23 likes, which would be great. All right. So right here it says Dr. Katrina Armstrong, who heads Columbia University's Irving Medical Center, says over the last 20 years of her career, one of the challenges in medicine has been this division between people who say we're public health people and then people who say we're healthcare. I think the revolution that is happening is that we're truly bringing those pieces together. After more than 2 years in which doctors and nurses had witnessed the reality of their patients' home lives through a telemedicine screen, we are starting to see so many people be able to really understand the context around their patients and really engage with every part of the healthcare system, she says. All right. So now here's some numbers here. Having had COVID-19 increases the risk factor for stroke and heart failure a year after the infection. Now, I want to ask you guys an honest question. All right. And I want everybody to participate. Do you all think that what's increasing these after effects, do you guys think that it's actually COVID, or do you guys think that it is vaccine or treatment? That's my question for you guys. What do you guys think? Is it actually COVID, or is it the vaccine and treatments? Let me know what you guys think in the comment section. Okay. So now here it says Armstrong believes that part of the solution to keeping people more fit lies in bringing healthcare closer to where they live. Somebody agrees with me. Somebody agrees with me. How do you bring healthcare closer to where these people live at? What are some ways that you can bring healthcare to people? That's good. Yeah, I agree. All three. And I agree 100% with what Cameron is saying. Needs more research that they will announce the facts and data and statistics of 25 years from now. Yeah, that's facts. Yeah, now I agree with you there. Hey, Mr. Knickerbocker. I don't think it'll happen either. I think what they'll do is they'll keep talking about how good it is and they'll keep showing evidence for it. But will it actually happen? I don't think so. They hype everybody up like they're actually going to try to make a positive change. Then it won't happen. So I got to agree with you on that. So now here it says using telehealth, nursing programs, and community health workers to reach patients in their homes. Now, if you ask me, they need to utilize technology and artificial intelligence because they could actually do that. But the question is, will they? And if they do it, will they do it with good intention or will they do it in a corrupt way? You was hoping Bernie would win because you wanted the universal health care? Yeah, to a lot of people, universal health care is important. Here's my question. If Bernie had a won, do you think he would have lived through 8 years? Or do you think he would have lived through, 4 years? He's old. He's up there. If he gets COVID, I don't think we're gonna be hearing too much more from him. So now here it says Colombia is also rethinking how to educate the next generation of doctors. Now, I got a question for you guys. What do you all think can be done to improve the education efforts of doctors? What can be done? Yeah, Bernie is absolutely against reparations. That's a fact. But he's not against reparations for Native Indigenous Americans. He's against reparations for basically for foundational Black Americans, which everybody's against everything for foundational Black Americans. So that's just the theme. That's the American culture. If it's for foundational Black Americans or if there's any benefit that can affect uh, foundational Black Americans positively, then it's a no, which is one of the reasons why I don't believe in being dependent on the government or negotiating with terrorists. I believe in doing things on our own and taking shit over. You know what I'm saying? So now here it says medical students now spend more time outside the hospital, undertaking stints in the community. A team approach is encouraged in order to break down the barriers between different specialisms and categories of staff. Similar lessons have been absorbed in Europe. building on the ethos established during the pandemic, which normally rigid lines between different specialisms blurred amid the demands of COVID. Jorn Zoka, the chief executive of Sweden's Karolinska University Hospital, one of the continent's biggest teaching hospitals, says that in a highly specialized institution such as his, you have a lot of silos because people know a lot about one thing. However, at the height of the pandemic in the intensive care unit, we had plastic surgeons staying in the dispensary, taking out meds for the nurses because they could not operate. Everybody helped out and had a role that made people more understanding of what their colleagues do. One of the things that we want to keep working on now post COVID is that collaboration, that team works, he added. So now here they're talking about educating and empowering. Now, I want to ask you guys a question. Do you guys feel that people currently have an adequate understanding, not only of just COVID, but an adequate understanding of healthcare in general? What do you guys think? Do people currently have an adequate understanding? If you guys think that people currently have an adequate understanding of healthcare, give me a thumbs up in the comment section. If you guys don't feel that they have an adequate understanding of healthcare, give me a thumbs down. Let me know how you guys feel. What do you guys think? So now here it says, as they cope with rising demand, many health systems will have little choice but to use existing staff more flexibly. Even before the pandemic, experts calculated that the world was 6.4 million doctors and almost 31 million nurses short of the numbers needed to provide safe and high quality care. Now, I would tend to agree with that, but the problem is that it will not be utilized. It will not be utilized by the healthcare institutions because they're not willing to use that money. They're not using to put that kind of budget investment in staffing like that because they don't have to, because the state organizations and the federal organizations don't force them to. So despite the fact that they may be saying that this is what's needed, they're not going to provide it. They're not going to do anything about it. You know what I mean? If you guys think that they're going to improve in some way, let me know. If you don't think that they're going to improve in some way, also let me know. Me personally, if you ask me, I don't think that none of this is nothing's gonna get better anytime soon. They're gonna just put this out here as if we've got the solution, but what's gonna end up happening is we're never gonna solve the solution. You know what I'm saying? Exactly. I agree with that. Well, that's a perfect way to put it. Hey, Mr. Knickerbocker, that is on target accurate. Think about this. They are literally paid to save lives, but they answer to administrators who are there to save money. And not to mention it, beyond the administrators, those nursing homes and hospitals are now part of real estate mutual funds that are literally meant to increase shareholder value by decreasing the investment that goes into those businesses. A life and death business. Facts. I agree. 100%. If you guys agree with, hey, Mr. Knickerbocker, give me a thumbs up. I agree with that. 100%. That's a perfect way to put it. You know what I'm saying? So now here it says, in this context, ensuring resources meet demand may entail a more organized system of risk stratification with patients' individual vulnerabilities calculated before decisions are taken, not only about their treatment, but the level of healthcare professional who should provide it. So even still, what would end up happening is if they allow lower level healthcare professionals to provide higher level treatments, what's going to happen is they're still going to scale back on the amount of money that they spend and start investing more money into the lower level healthcare professionals because they can pay them less and get more of them. It's all about saving money. None of it is about saving lives or improving the quality of people's lives or even saving people's lives. None of it is about that. That's not what it's about. What it's about is increasing shareholder value at all times. That's the only thing that it's about. That's the only thing that it's about ever. You know what I'm saying? So now here it says Dr. Xavier Cause Claremont, a Barcelona based general practitioner and diabetes researcher who chairs Primary Care Diabetes Europe, believes that resources are no longer sufficient to give every patient the same level of follow up. Now, I want to ask you guys a question. Do you all see this phenomenon happening here in the United States? That patients don't have the facilities are not providing the resources to give patients appropriate follow-ups. Do you guys see that here? If that's something that you've noticed here in the United States, give me a thumbs up. If it's not, give me a thumbs down. Far more precise assessments of individual risk will be required, perhaps involving the use of artificial intelligence to interrogate big data sets. There we go. It's that nasty beast again. Moonwalking. I keep trying to tell y'all. Artificial intelligence. Here it is. Because it can do it faster, cheaper, and more efficient than human beings can, and probably more accurately. Carla says most people don't understand healthcare. I agree. Most people have their perception of healthcare, which is dangerous because their perception of healthcare is how they feel it's supposed to happen. And because the people who are running healthcare have turned healthcare into a customer service based business instead of a results based business, you have to succumb to what the customers who are not healthcare professionals want. You know what I'm saying? Instead of what they need. There's a big difference between what people want versus what people need. And a lot of times people are dishonest with themselves and they can't discern what they want. They can't discern the difference between what they want versus what they need. There was a robot that broke the little boy's arm playing chess. I mean, here's the thing though. That's how you stop them from making moves. And that's how artificial intelligence is thinking about it. It's not thinking about harming a person. You know what I mean? Artificial intelligence is like fuck your feelings for real. Right. Effing Mecca moonwalking into the healthcare industry. He about to fly his Bugatti helicopter to a trauma center near you. He about to pull up in the Gucci Tesla ambulance. You know what I'm saying? So now here it says, in some instances, this could mean patients working with coaches rather than clinical staff to look after their health, perhaps with the support of wearable type technology. The most highly qualified staff would then have more time to care for the patients whose conditions really warranted it. You know what I'm saying? He tried to play out a turn. So the AI basically took it back to back in the day where if you play out a turn or if you steal, it's cutting your hand off. You know, we have religions where they do that too. If you violate somebody, the body part that you violated somebody with, the religion says to cut them off. So is AI different than people? You know what I'm saying? I mean, yeah, is that offensive? Is that offensive? That's the question, because we're doing that too. People are doing that too. As a matter of fact, people base their whole lives on religious systems that says that to do that. You know what I'm saying? You chop the hand off of a thief. Okay, well, what do you do to a cheater? You know what I'm saying? I mean, I don't know. I find that interesting. You know what I'm saying? I find that interesting. So now here it says patients would in turn need to be educated away from reliance on a paternalistic model and helped to understand that they needed to take responsibility for their own health, he argues. Yeah. I mean, like that. Duh. We have a huge problem with the world culture of not taking responsibility and then shifting accountability, just blame shift all over the place. It's really annoying. Now, my question for people is, why do we do that? I agree with you, Carla. They treat symptoms. They're not looking to treat the disease. That mean, and also they're not looking to prevent the disease either. That's an issue. Now, here's my question. What are individuals doing to maintain their own health before they go to the doctor's office? Are people doing anything significant to be responsible for their own health? Or what are people doing to be responsible for their own health? If anything, are we doing anything out here? What are we doing out here? That's the question. So now here it says, but healthcare professionals, policymakers, patients, and citizens would all have to align around the new approach if it was not simply to create fear and resistance, he warns. Some patients may struggle with this notion of empowerment. At Columbia, Armstrong says the pandemic taught her how many patients without health insurance relied on informal networks of support, whether from nurses at urgent care centers, pharmacists, or family members. The pandemic had frayed these support structures, revealing a big gap in patients' knowledge about how to care for themselves. People out here can't even care for themselves. And Carla had just said it up here. Most people don't understand healthcare. Not only do most people not understand healthcare, most people don't even understand how to care for their own health. We're talking about adults. We're talking about adults. Carla says the healthcare professionals don't even explain the disease symptoms and treatments clearly. And probably one reason why they don't is because they themselves probably aren't even capable of doing it. They're probably not competent because competence is a rarity in today's world. Competence is almost as absent in today's world as common sense is. So now here it says when people came in, we kind of talked at them, sent them home, and assumed it was all going to be okay. But you really have basic health literacy. You have to have basic health literacy to survive in this quote new world order. Now, that's interesting. What new world order? This is a healthcare article talking about new world order. What new world order? What new world order? What are we talking about here? What new world order are we talking about here, guys? There's a new world order. So now here it says in Singapore, Jeremy Lim acknowledges that structures must be kept in place for those who perhaps for reasons of disability or discomfort with technology are not able to take their health destinies into their own hands. Yet, even if only 50% of patients were able to take charge in this way, that means there's a 50% of the resources freed up to care for those patients who otherwise would have gotten 5 minutes with a doctor when they should have gotten 35, he said. As an example, Lim pointed to patients who previously have visited their family physician 4 times a year for blood pressure checks, but could now take their own measurements automatically via their phones, with the result uploaded to a system that the doctor or nurse could track remotely. An algorithm would flag up outliers. Now, I mean, you guys see the direction where healthcare is going in. You guys see the direction where healthcare is going in. My question is, are there business opportunities there? There are. But is that what people are talking about online? Is that the wave? Like, my question is, like, is that such a cool concept that there's like 5 live streams going on right now about how to take over the healthcare industry? No, there's not. And there's not gonna be unless a bomb goes off or something. So now here it says one of the big discoveries of the pandemic was that technology and self-testing are key to enabling health systems to cope with a workforce that does not rise in line with the demands, he says. So see, again, this is one of the same things that I was saying right here. This is one of the same things that I was saying right here. So now what people could do is create a pathway to a more efficient healthcare system, pave the way, come out with processes and different things like that. Intellectual property of how to have efficient healthcare. Not difficult. We in healthcare have always felt that we were unique, that healthcare is very, very bespoke, and that the more patients you had, the more healthcare professionals you needed. That calculus had shifted during the COVID crisis, moving the sector closer to the model of financial services, in which physical visits to a bank are reserved for complex transactions such as mortgages, with more quotient needs met online. I think over the past 2.5 years, we have learned which type of health conditions are amenable to telemedicine, for which types of diseases patients can actually self help, Lim says. So, now what this article here is implying is that the wave of the future is that people will be expected to have a certain level of competency with dealing with their own health. People are going to be expected to take responsibility for their own health. More and more in the world, you see the repeated theme of people being expected to take responsibility for their own outcomes. What if people have historically not done that? What's going to happen? How is that going to work? How's that going to work out for people? What's that going to look like? That's the question. What is that going to look like? Does anybody know? Is that gonna be a good look? So now here it says, far from being a solution that was only practicable in wealthier countries, I would argue it needs to happen in the developing world even more because resources are much more constrained. The rich world has the luxury of being inefficient to some extent, but the developing world has no choice but to be clever. So in the long term, in my opinion, in the long run, in the long term, the developing world is going to have a healthcare advantage over the established world. What do you guys think? So now here it says a long-term challenge. Even as health systems around the world adjust to what many fear will be an era of structurally higher demand for healthcare, researchers and clinicians remain divided on how irrevocably the landscape of illness has been reshaped by COVID. The IHME Murray believe that more data is needed to draw firm conclusions. What will the future trajectory for people's health be once we come out of COVID? Will it look very different? That's the question. And that's the part that I think still remains to be proven, Murray says. This may be a 3-year shock and not a shock that will last many, many years. Glenn Dodd, associate professor at Oxford University's Nuffield Department of Clinical Neurosciences, who led the study on brain shrinkage, that shocked strain, agrees that it is too soon to make predictions about future burdens. And Cameron said that. Shout out to Cameron. And I said that as well. It's way too early. You know what I'm saying? Nobody's going to be able to come up with these kind of things. It's going to take a while longer. Some of these impairments, cerebral and cognitive, may partially normalize in time, she says. Ultimately, this is something only extensive follow-up studies will be able to tell us. But as he prepares to publish further findings from his scrutiny of the VA database, Al-Ali is in no doubt that clinicians and society at large will be dealing with the after effects of COVID in perpetuity. What does that mean? That society and clinicians will deal with after effects of COVID in perpetuity. What does that mean? What is he saying when he says that? What is he saying when he says that? This is not something that will go away in a week, in a year, or 2 or 3. This will reverberate with us for generations, he says. So, again, like I said a long time ago, this right here is something that people can utilize to generate generational wealth. But what you see is that that's not being done. You know what I'm saying? You don't see efforts about that. You don't see people having Twitter spaces about this. You know what I mean? So we cannot continue to act surprised when we don't see people benefiting from these kind of things. It's insane to act surprised when there's an absence of effort. Yeah, it means forever. Facts. Yeah, facts. Hey, Mr. Knickerbocker, they're going to have beef with COVID forever. Carlton says means forever. Right. In Singapore, Lim is striving to see opportunities amid the challenges. Now, see, in Singapore, Lim is striving to see opportunities amid the challenges. In Blacklight Revelations, Rob is striving to see opportunities amid the challenges. But, I mean, is Byron Allen? Are athletes? Are affluent people? Are the people who feel that we're in a bad situation in society? Are they doing it? What are they talking about? You know what I'm saying? Healthcare is now front and center of many governments and global agencies' agendas, which means that if it's at the forefront of many government and global agencies' agendas, what that means is that there's a lot of money that people can drill out from the government. Right. That's exactly what people will say, Carlton, but nobody told us. We wasn't told. We've been tricked. No, you haven't. You've been talking about Busta Rhymes and Fat Joe, watching Kevin Samuels reruns. You know what I'm saying? You have been told. But you're right, Carlton. That is exactly what everyone will say. If you've been told and people continue to say, but nobody has told us, how do you continue to communicate and try to make any improvements working within that sector? How does that work? You know what's crazy? If I write some shit on a wall and I come back and read it, that same shit will be on the wall, which means that the wall can't lie and say that I didn't tell them about it. So it's almost like you'd have better luck communicating with a wall because at least there's proof. Like it's still written there. I mean, this I've been talking about this kind of stuff for a long time. This channel's been around since C19 first happened. Do you know what I'm saying? As good of viewing as this channel gets, this is my least daily viewed channel. And when I say least daily viewed, I'm not talking about the people that watch the live streams and the regular people. I'm talking about the new exposures. You know what I'm saying? When you look at the algorithm, the blue line, you know what I'm saying? That means people that actually are new, who are not subscribed to the channel. So what that means is that there's not really a lot of people looking for this kind of information. You know what I mean? But they want it on demand when it affects them, though. But that's not how it works. You know what I'm saying? It doesn't work that way. So now here it says, hopefully there is much more. Look at this prioritization. There's much more investment into healthcare. But as the but as the world's health needs have grown in the aftermath of the pandemic, he warns, and if our tools to address healthcare demand don't change, if our models of care don't change, then let's just say we're in for a very, very bumpy ride. So, Carlton, are we going to be dealing with a bumpy ride? Are we going to be dealing with a bumpy ride or not? What do you guys think? Let me know what you guys think. Bumpy ride ahead or not? So, one thing that I want to show you is how stupid people are. I don't know if you guys were aware, but ivermectin was trending on Twitter earlier today. Is anybody aware of that? There was a UFC fighter named Jake Shields, if I'm not mistaken, who put up a tweet about ivermectin. This woman here, Dusty Desert Dweller, put up a tweet that was supposed to be a supporting tweet to Jake Shields, and I used her tweet because she actually has a screenshot from the National Institute of Health, and I also have the page from the National Institute of Health up. And what I want you guys to pay very close attention to is I want you to pay attention to how much of an idiot these people are. Okay. And the reason why I want you to pay attention to how much of an idiot these people are is because I'm tired of these people saying that they're inherently smarter than everybody else and everybody else just kind of being quiet. I'm tired of that because you're not inherently smarter than anyone. And damn near every time you open up your mouth, it shows how much of an idiot you actually are, but nobody capitalizes and jumps on it. Now, this woman here, she says on her tweet, suddenly ivermectin shows up on the NIH website for treating COVID. After years of denial, blocking, interference, vilification, ruining social media accounts, killing people, they silently added to their antiviral protocol. On this screenshot that she shows here, none of what she's saying is true. Antiviral therapy. These sections summarize the data on ritonavir boosted nirmatrelvir, remdesivir, and other antiviral medications. All right. Now, if you go down to where ivermectin is listed, It says ivermectin is an anti-parasitic drug that is being evaluated to treat COVID-19. It doesn't say that it's an approved treatment. Right here, remdesivir, it says remdesivir is a nucleotide analog prodrug that is approved to treat COVID-19 in certain patients. So when these medications are approved, it says that they're approved. When they're not approved, it says that they're being evaluated. So what this woman did effectively was posted a screenshot that debunks her claim. I mean, how stupid can you be? Seriously. Suddenly, ivermectin shows up on the NIH website for treating COVID. Okay. After years of denial, blocking, interference, vilification, ruining social media accounts, killing people, they silently add it to their antiviral protocol. Where? Where is it added to the antiviral protocol? It's under antiviral therapy, and it says it's an antiparasitic that is being evaluated. Evaluated means that it hasn't been determined that it's an inappropriate treatment yet. Unless they change the definition of the word evaluation, which they've been known to change the definitions of words lately. So my question for everybody is, does that make sense? Like, it just amazes me how certain people can just say anything and even use shit that makes no sense and just say this is a fact. That's just like Ron DeSantis getting up there talking about the moral compass of Abraham Lincoln. What are you talking about? Abraham Lincoln didn't have a moral compass. This shit was broken. So now even Twitter comes on here and says this tweet is incorrect. Ivermectin has been addressed on this page since it was first created in June of 2021 and has, as seen by the Internet Archive. I mean, how do you do that? So now here's the actual page that she had up. That she said more than that. It shows up on the website. She said that they added it to the protocol of COVID-19 treatment, and it's not. She was utterly and blatantly incorrect. It's not part of COVID-19 treatment. It's on here because it's being evaluated. Ivermectin is an anti-parasitic drug that is being evaluated to treat COVID-19. Evaluated, which means that it hasn't been approved yet. Now, here's NIH again. COVID-19 treatment guidelines. Ivermectin. Nowhere on here does it say to treat COVID-19 with ivermectin. There's nowhere on here where it says that. It's under COVID-19 treatment guidelines because there's been talk of people using it with COVID-19. So she's wrong as hell, which is why Twitter stepped in and corrected her tweet. Ivermectin is a Food and Drug Administration approved anti-parasitic drug. Last time I checked, COVID-19 was a virus used to treat several neglected tropical diseases, including onchocerciasis, helminthiasis, and scabies. For these indications, ivermectin has been widely used and is generally well tolerated. Ivermectin is not approved by the FDA for treatment of any viral infection, any, including COVID-19. How do we just skip that part? Like, that's the bitch that'll call the police on you and shit. You know what I'm saying? That's a Karen. I'm white and I say so. Like, no. You know what I'm saying? Like, ivermectin is not approved by the FDA for the treatment of any viral infection. Any. any viral infection. Now, what does this say right here? Proposed mechanism of action and rationale for use in patients with COVID-19. Proposed, which means that it's something that somebody is proposing and has not been finalized yet. Finalization could possibly come at a later date, but it's not here currently. This is why shit like this is dangerous, because you literally get Marlboro Red smoking trailer trash, get up on Twitter and just post anything. Like, no, that's wrong. You know what I'm saying? Reports from in vitro studies suggest that ivermectin acts by inhibiting most host important alpha beta 1 nuclear transport proteins, which are part of a key intracellular transport process. Viruses hijack the process and enhance infection by suppressing the host's antiviral response. In addition, ivermectin docking may interfere with SARS-CoV-2 spike protein attachment to the human cell membrane. It may. Some studies of ivermectin have also reported potential anti-inflammatory properties, which have been postulated to be beneficial in people with COVID-19. None of this stuff is definitive. It's all just proposed. That is why Twitter stepped in and corrected her stupid ass tweet. Her stupid ass tweet that she actually had a screenshot of debunking her claim. You know what I'm saying? Like that is dangerous, man. So now here it says ivermectin has been shown to inhibit replication of SARS-CoV-2 in cell cultures. However, pharmacokinetic and pharmacodynamic studies suggest that achieving plasma concentrations necessary for the antiviral efficacy detected in vitro would require administration of doses up to 100-fold times higher than those approved for use in humans. Although ivermectin appears to accumulate in lung tissue, predicted systemic plasma and lung tissue concentrations are much lower than 2 nanometers, the half maximal inhibitory concentration IC50 observed in vitro for ivermectin against SARS-CoV-2. Subcutaneous administration of ivermectin, which would be 400 nanograms per kilogram, had no effect on SARS-CoV viral loads in hamsters. However, there was a reduction in olfactory deficit, which you guys know what olfactory is, measured in a food finding test, and a reduction in the interleukin 6 to interleukin 10 ratio in lung tissues. So the problem that they're having is dosing it for humans. Recommendation. The panel recommends against the use of ivermectin for the treatment of COVID-19, except in clinical trials. I mean, like, this is what I'm saying about we live in a post-truth society. Like, the shit is right here. We live in a post-truth world, man. People really want some shit to be some way, and they feel some sort of kind of way about it. And because they feel that way, we're just going to say it and make it true. It's not true. Like, it's right there. All she had to do was just click on ivermectin. And so now here's my question for everybody. Why did she show this screen and not show this screen, not show the ivermectin screen? Why did that happen? Why did she do that? You know what I mean? And is there going to be a consequence for it? Of course not. Because why would there be? Why would there be? Why would there be any consequence for a Karen making some shit up? Is there ever? So now, as a result of all of this, Reuters came out with a fact check. And this is an old fact check. This is from October 27th of 2021. That tweet was just made today. Like, this information has been out here. As a matter of fact, I have a video on this channel about that very thing. Hold on real quick. Yeah. I'm going to show you guys real quick the video that I have about it. There's a playlist on this channel, and the playlist is called Ivermectin. Here it is right here. Mask supremacy versus pandemic privilege. The truth about Joe Rogan and Ivermectin. Ivermectin, when the system goes full illegitimate, courts attempt to override doctors' decisions. And then the stream that's going on right now. I mean, like, you can't make this shit up. You know what I'm saying? You cannot make it up. So I would advise people to check those videos out. So now here, fact check website does not prove government silently approved ivermectin as COVID-19 treatment, which, I mean, Jesus Christ, I mean, like, how much more clear does that need to be? This is what I'm saying about, this is the strategy that particular people use to just repeat something. We're just going to repeat, and we're just going to repeat, and we're just going to repeat, and we're just going to repeat until it's true. No, you're not. You know what I'm saying? Like, it's not true. Contrary to social media claims, ivermectin remains unapproved for treatment of COVID-19 by U.S. health authorities. The National Institute of Health has not silently approved it. It's, I mean, how would somebody come up with that? If they even read 2 sentences on there. A post on Instagram claims, which again, now we saw a new post on Twitter. It claims that the NIH website now says ivermectin is approved for emergency use authorization, which it's not. So then they give a link. You know what I'm saying? I'm gonna show y'all where, and they took that down. They took that post down off Instagram. It got deleted. So now it says similar claims can be found on Facebook here and Twitter here, which these are probably taken down. Nah, it's still, the Twitter thing is still here. So I'm gonna show y'all this Twitter post right here. If you guys haven't smashed the like button, please make sure that you guys smash that like button. Also, if you're not subscribed to the channel, make sure that you hit that bell icon twice. And also, please make sure that you guys share the video out. National Institute of Health and CDC now say ivermectin is a drug to be used for COVID-19. No, they do not. It does not say that. There is nowhere where it says this. Like, how do you just look at this? This dude got 29,500 followers. And he's just posting bullshit on Twitter. How does this work? Here's what he put up as his proof. That same site that we were just at. Just because something is an antiviral agent does not mean that it is approved for treatment of COVID. That's not what that means. I mean, I'm going to show you guys this, right? I want you guys to see this. This is the site that he put in his tweet. All right. Matter of fact, I'm gonna give you guys this tweet here. Here's the tweet. It's in the chat for people watching the live replay. There's the tweet. Okay. Here's the link that's supplied in the tweet. There's the link that's supplied in the tweet. Now, if there's anybody that's still active in here watching this, I want you guys to go and check out both of those links. All right. Go check out both of those links. So now what I'm going to do is I'm going to put up the link that was supplied by that idiot Twitter account. All right. National Institute of Health, COVID-19 treatment guidelines. This is giving the guidelines for use in a clinical trial. Not approved by the FDA, not recommended by the panel for treatment of COVID. Currently under investigation in clinical trials. These are the doses that they're using in clinical trials. It is not recommended and it has not been approved by the FDA for use. Why is that so difficult? Why is it so difficult to read by the very people that'll call you stupid? Sheesh. So now here it says claims on social media seemingly take out of context a table from the NIH displaying characteristics of antiviral agents that are approved or under evaluation for the treatment of COVID-19, not understanding that it includes drugs still under evaluation as clearly stated. Current COVID-19 emergency use authorizations can be seen on the U.S. Food and Drug Administration's website here. So we'll look at this. Actually, I'm gonna put the link in here for you guys so you guys can check it out. These are the current emergency use authorizations. So again, if you're somebody that's watching this channel for research purposes, all you have to do is at this point look at the live chat and it'll have all the links that you need to verify any information. I know, right? The fact checkers came in immediately to straighten her out. And you guys know, you know what I'm saying? A lot of times the fact checkers are not accurate, but in this case, the fact checkers are absolutely 100% accurate. We still got, hey, Mr. Knickerbocker in here. That's what's up. Good to see you as always. Glad you're still here. So if you're watching on Facebook, if you're watching on Twitter, if you're watching on YouTube, all you got to do is hit those links that I just put in. They'll take you to everywhere where you need to go, and you'll be able to look at all the information and verify everything that I'm saying. You know what I'm saying? So now here it says Allison Hunt, press officer at the FDA, told Reuters via email that currently FDA has not authorized or approved ivermectin for use in preventing or treating COVID-19 in humans. I mean, the way that these people just sit up here and lie about stuff is just insane. It's just insane, man. It's just wild. So far, in terms of ivermectin approved for human use, only a different version of ivermectin is approved by the FDA to treat people with parasitic infections, including intestinal spondylitis and onchocerciasis, as well as rosacea and head lice, she says. Okay? Parasitic infections, because ivermectin is a anti-parasitic. It's not been approved for treatment of any viral symptoms or any viral infection. Know what I'm saying? Guidance from the FDA dated September 2021 discourages the use of ivermectin as a treatment for COVID-19. So, I mean, look at this. This is the Food and Drug. I want you guys to see this. So my question is, where are these people getting this from? But what I want you guys to pay the most attention to is pay very close attention to how those people still have their social media accounts, and pay close attention to how YouTube and, Facebook and TikTok also deleted my videos. I mean, this is coming straight from the FDA right here. So what are these people talking about? Look at this. What you need to know about ivermectin. The FDA has not authorized or approved ivermectin for use in preventing or treating COVID-19 in humans or animals. I mean, where do these numbskulls keep coming up with this idiocy that they keep babbling about on Twitter? I mean, what is the title of this right here? And this is what I'm saying about how we live in a post-truth society, because these people want so badly, for some reason, I don't know why, a lot of these people, especially conservatives, must have some corporate interest in Merrick or something like that. They want so badly for COVID-19, you know what I'm saying, to be treatable by this, and they want the FDA to approve it so bad that they just make shit up when it says clearly, blatantly what time it is. So now here it says clinical trials evaluating ivermectin as a viable treatment for COVID-19 are ongoing. So again, that's not to say that at some point in the future, ivermectin will be okay. It's just saying currently right now it's not. And I mean, people having a temper tantrum about that. You know what I'm saying? And you know who those people are. It's the same people that have historic and legacy temper tantrums. You know, the ones who got mad that the guy that they voted for didn't win. So now here it says, in an emailed response to Reuters, National Institute of Health spokesperson Ken Peacock, that is interesting, denied claims that the agency quietly approved ivermectin as an approved treatment for COVID. He directed Reuters to the page for ivermectin's treatment guidelines here, where use for COVID-19 is indeed not listed, which we just showed all of those. Peacock asserted that the NIH guidelines are updated regularly to ensure that they are current and that people can sign up for updates so that they are notified whenever there is a change on the page. Verdict: that tweet is false. Linked document does not provide U.S. government silently approved ivermectin as a treatment for COVID. As part of this article's publication, ivermectin treatment for COVID-19 remains in the clinical trial stage. The article was produced by the Reuters fact check team. Read more about our fact checking work here. So, I mean, they actually did an accurate job fact checking on that. That was complete nonsense that lady put up. So now the last thing that I want to show you guys, I want to show you guys the academic journal that talks about the brain issues that people have as a result of currently, allegedly, COVID. All right. So this is an article from the Nature Journal. Not something that you will see a bunch of people doing a Twitter space about. So now what's most important here is the abstract. The abstract, and if they have a conclusion, we'll look at the conclusion. Okay. Well, I think we're just going to look at the abstract because I don't see, it doesn't look like they have a conclusion. The rest of this stuff, for the most part, is just research methods. There is strong evidence of brain-related abnormalities in COVID-19. However, it remains unknown whether the impact of SARS-CoV-2 infection can be detected in milder cases and whether this can reveal possible mechanisms contributing to brain pathology. Here, we investigated brain changes in 785 participants of UK Biobank. These people were aged between 51 years old and 81 years old, who were imaged twice using magnetic resonance imaging, which is an MRI, including 401 cases who tested positive for infections with SARS-CoV-2 between their two scans, with 141 days on average separating their diagnosis, and the second scan, as well as 384 controls, which are people that don't have any out of whack variables, just basically normal. Okay. The availability of pre-infection imaging data reduces the likelihood of pre-existing risk factors being misinterpreted as disease effects. We identified significant longitudinal effects when comparing the two groups, including one, a greater reduction in gray matter thickness, which is what we were talking about the shrinking, and tissue contrast in the orbital frontal cortex and in the parahippocampal gyrus. Greater changes in markers of tissue damage in regions that are fundamentally connected to the primary olfactory cortex. All right. So that might be one of the reasons why there are those issues with the sense of smell. Okay. That also might be why people have issues with their smell and their taste returning. COVID is affecting people very differently. And there's some people who have ongoing smell and taste issues. And three, a greater reduction in global brain size in the SARS-CoV-2 cases. So be careful. COVID may shrink your brain. You know what I'm saying? You might want to be weary about that because people nowadays don't have a lot of brain cells to waste. You know what I'm saying? The participants who were infected with SARS-CoV-2 also showed, on average, a greater cognitive decline between the 2 points. So now these are the people that have, I don't know if you guys have ever heard of COVID cloudiness. How many people have heard of COVID cloudiness? If you guys heard of COVID cloudiness, give me a thumbs up. If you have not heard of COVID cloudiness, give me a thumbs down. COVID cloudiness is an issue. I said the same thing, Carlton. People already have small brains to begin with, and now they worried about getting even smaller. You know what I'm saying? People better be preserving their brains. That's why I don't agree with smoking weed and doing all them drugs and shit. You know what I'm saying? People already only have 1 or 2 brain cells as it is. Why would you want to burn out the few that you have? You know what I'm saying? Importantly, these imaging and cognitive longitudinal effects were still observed after excluding the 15 patients who had been hospitalized. These mainly limbic brain imaging results may be the in vitro hallmarks of a degenerative spread of the disease through the olfactory pathways of neuroinflammatory events, or the loss of sensory output due to anosmia. Whether this deleterious effect can be partially reversed or whether these effects will persist in the long term remains to be investigated with additional follow up. So that's the abstract. That's basically talking about the questions and things that this research is looking to get the answers to. You know what I'm saying? Will they ever get the answers to this information? In my opinion, probably not for about 5 to 10 years. You know what I'm saying? So, with that being said, ladies and gentlemen, that is the end of the stream. I hope you guys found this stream as informative as you found it enjoyable. All right. Make sure if you're not subscribed to the channel, you hit that bell icon twice. Also, make sure that you smash the like button. Share this video out to all of your followers. Also, if you guys enjoy the content, make sure you help to YouTube proof the Black Light Revelations Network by joining Patreon. All right. It's only $5.99 a month. That definitely helps to not only keep the audience together, it helps me to be able to upgrade and provide more and better quality content. And also, most importantly, it helps me to YouTube proof the channel, which is important. All right. So with that being said, y'all have a good night. I will catch you guys on the next stream. Peace.